Hello, friends. Welcome to my YouTube channel, Dr. J Official. I'm Dr. Jamali, psychiatrist working in the UK. And today we are going to talk about research ethics. So, when you have a research protocol and you want to start a study and which involves human participants, then you have to go through ethics. So, today we are going to talk about what are the key points to be mindful of when you are writing an ethics approval application. So, one is we have to be very mindful of who is in the panel. This includes the clinician who may be from the medical profession, if it is a medical or a clinical research, but that there would also be panel members who are non-medics. And they also have a lay member as well. So from common public, there would be somebody representing the common public as a lay member. So they may not have enough clinical knowledge to understand. So it is very important that, when you are summarizing your study, it has to be very easy to understand for anyone. So as I said, that it has to, your summary has to be understood by lay reviewers and the member of public. What exactly your objectives are from this study, you have to be very clear. It has to be very simple and very feasible. So you may have loads of ideas, but then it has to be practical enough to be implemented. So when you are submitting this to the ethics, make sure that what you're trying to do is achievable, it is feasible enough. Now, feasibility in terms of recruiting participants, in terms of addressing any untoward medical complications or side effects, or whether it comes to the cost. So again, we have to be very clear with those in a very simple way, so that it is easily understood and it is practical enough to do. So the summary design, whether it is the randomized control trial, or whether it is a cross-sectional study, or whether it is a cohort or a case control study, it has to be easily understood. And very, very important, before you submit your ethics, or even before you're submitting your research proposal, it is very important that the general public is involved. It can be at any stage, because at the end of the day, you're doing this for public, isn't it? Whatever medication you're trying to study, whether this medicine is going to be effective for a particular condition, you're doing that for public. So whilst you're designing your research protocol, it is important to get a general public involved, whether it is through a group interview, or whether it is in a social group session where you're talking about the study. Many research and development, the teams in every hospital, they do such sessions where they involve general public and they talk about their study to get some feedback on what they think. Whether it comes to managing the research, whether it comes to recruiting participants, you can do this via social media as well, these days, by just talking about your study and getting some feedback. But you can do that, in your hospital, in the university, where you arrange these sessions, a very informal session, and you talk about this to the group. Whether that group could be somebody you are actually trying to address in your study. So maybe it's worth inviting. So say, for example, you're doing a particular study on smoking, for example. So you may invite, people of, across the age group, where you feel the risks are high, and talk about it. And you can get some very good feedback on what exactly their concerns are, which may help you in developing your research proposal. And even, when it comes to recruitment, another example is, say, if you're working on dementia, for example, and you want to recruit participants, but you want to know whether the study is, how important this study is to the general public. So Your target audience could be family, family members, where in that family they've got somebody with dementia, so they would want to know more about this. So maybe you can include family, friends of somebody who is suffering from dementia. So you can, you need to know who your target audience are, and then you talk about your study. How are you going to undertake this research? You can get a lot of ideas from public. How are you going to do this? Where are you're going to recruit the participants from? What would be an appropriate environment to do the study? So for example, if you're doing a qualitative study, for example, where you're doing these structured interviews, what would be a better platform, whether it is face to face or whether it is online, whether it is virtual, whatever. So you can get a lot of ideas, when you interact with people, whilst you're working on your research. Even when it comes to analysis, it depends on at what stage you want to involve public, but it is very important that you include them. And dissemination of findings. So you've collected the data, you've analyzed it, but then you want to share it with people, that what were your findings from the study. So you can involve public at every stage of your research. So these are some of the examples, whether it comes to designing of the study, management of the study, undertaking the research, analysis of the results, and dissemination of your findings. Risks and burdens for research participants. Very important that in your ethics application you're including any potential adverse effects from, say, if you're doing a trial of a particular drug, then it's important to preempt what could be the potential adverse effects and how are you going to deal with that. Any sort of inconvenience, it could be anything, whether it is travel or whether it is the study in itself. So that is something which you need to preempt and try to come up with a solution, in your ethics application. People, participants involving in the study can be distressed, could be any reason, whether it is during the trial, or whether it has got to do with how the trial was conducted. There can be a lot of distress around, so you need to ensure that how you are addressing that, and that needs to be captured in your ethics. Intrusion. So like, again, confidentiality is very, very important, but sometimes it depends on the type of study. When say for example, if you're doing in a qualitative study, if you're planning to do a group interview, not many people would want to disclose a lot of things. So again, you need to be mindful of all these things. So maintaining confidentiality is very, very important. And sometimes, even if you're doing a particular trial where you are trying a particular medicine and you need to do some investigations, for example, blood investigations, maybe sometimes the participant may not be comfortable. So again, it's about ensuring privacy, and also ensuring that the participants would have the right to say no if they don't want to, whether it is at the start of the study or in the middle of the study. They can withdraw their participation at any time. So we need to address these concerns, and how are you going to so if you foresee these risks or burdens, how are you going to address them? So again, what steps you will do. So again, these are very important points to pick up on when you're writing your ethics proposal, your ethics approval application. So just bear all these things in mind. You have to be very well prepared, and I think these things can be addressed whilst you're working on your research proposal. What most importantly, you're doing this for the benefit of the patients, isn't it? So what are the possible benefits of this? What can be the potential outcomes? So it's important to advise on that as well. Maintaining confidentiality is extremely important at every stage of research, wherever the participants are involved. So this was a brief overview on what are the key aspects to be mindful of when writing an ethics approval application. I hope this was useful. Feel free to put any comments, your feedback, that would be very valuable for me. If you like this video, please do press the like button and share it as well. Thank you very much. See you in the next video. Take care. Bye-bye.